Scar after breast reduction surgery. Now, friends, in breast reduction surgeries, it occurs with a scar around the nipple and a fold in the lower part. It used to be called lollipot. Extending down from the nipple, we used to do this a lot. However, after all of the patients we did with that techniques, we witnessed that many patients complained about a small pothole in the lower part after a while. It was a bit of a forced technique, actually, if you ask me, in order to leave more scars, but it does not disturb the patients very much in the traces in the lower fold. Here, the size and shape of the breast is important. In other words, there is no chance of making excessively large breast without undercutting. Correct technique always makes a patient happy. So maybe even if what we do at first seems like a lot of work to you, it is a subject that is discussed a lot in the world of this type. So over the years, many physicians, doctors, and I gave up on the L-shaped technique, that is the lollipop-shaped technique, which we have been trying to do for years by saying that the issue will be left more traces to the patients. Why? Because both the healing process and the setting process of such patients really took serious time, and the patients did not make positive returns during this period. However, these problems are less in patients with T-shape. In other words, recorrection treatment, which we call revision, is a traumatic process for many patients. There was a perception that there was something wrong, not the effort also for the doctor here. That's why I witnessed the most of my colleagues who made it in the L shape also turned into a T shape, especially in large breasts. That's why the T shape is here, so I wouldn't be exaggerating if I said it was the gold standard. The aim is not to make too many scars on the patient, but to reduce the patient's problem in the next period. For the patient who has a traumatic problem in the process of redoing, which we call revision, because the event is not only about performing the surgery, but the fact that the patient does not need any intervention afterward is one of the such criteria in this type of surgery. In other words, the breast reduction patient should not need such an operation again in the future. Revision surgery, which we say that the patient needs such an operation again, is generally considered for patients who have not shrunk enough, have not been erected enough at work, or have obvious scars. The most important thing, as I say it again as a doctor who performs this surgery quite often, the patient should be made smaller in line with his wishes. Sometimes patients can have very high expectations at first, so it's not always small. Some patients say it should stay big, just get upright. But there is a fact that should be known here, that the breast is not an organ above which is attached to the bone, but it is surrounded by a skin envelope and it is attached to the tissue above with certain ligaments at certain times. Of course, we consider this situation of the patient when determining the surgical technique. However, it does not give the same result in every patient. If the patient's tissue is very loose, it has a soft structure and flexible skin structure, no matter how much you straighten it in such patients. And we give the patient the information about the condition of the tissue very comfortably during the examination. In some patients, the tissue is really good. If the tissue is very good, we do not encounter a big deformation or a big loosening in such patients even within 10 and 20 years. As I said, the condition of the tissue, condition of the skin, these are the determining factors. Again, the larger the patient's breast, the more the breast will leave on its own, depending on that size. Therefore, it should never be shown in the patient that it is in a way that is too large. In other words, it is more important for me to give the patient as natural and beautiful form as possible. This is for extremely large breasts. Sometimes the breast tissue is not really big, becomes saggy, and perceive the saggy breast as a large breast. Actually, big breasts are different, saggy breasts are different. In other words, the fact that the patient's breasts are saggy does not mean that their breasts will be large. Sometimes we may even need to put silicone together in patients with saggy breasts. In other words, the patient's tissue is weak, but the sagging is more prominent. In such patients, we have a chance to do it without reducing it. Of course, because we tighten the skin and tissue, the patient's breast comes to the form it should be. Sometimes it might be necessary to use even silicone in this type of nozzle. We can do it especially for the slack, the upper volume, that is in the upper part of the breast, or to fill the gaps there. Sometimes it can be a patient group that we use silicone and sometimes their own oils. When deciding on this surgery, we decide according to the patient's tissue and body structure. We can say that the state of this tissue is the most determining factor for BISM here.